Well, Michigan's population is more than 13% black, but less than 4% of those who've been vaccinated are members of the black community. It's a stark number, a stark contrast there. What's being done to address those disparities right now?
Well, Keenan, there's a lot of work to do to make sure that we address some of the hesitancy that exists in our Black community. But more importantly, with the data we released, almost half of the data isn't known in terms of the race or ethnicity of the people who've been vaccinated. And so we've been building systems to try to address that. And we established things like the Protect Michigan Commission to help people get the answers to the questions they need and the resource they need to make the choice to get vaccinated. Michigan's been a leader on reducing racial disparities throughout the entire pandemic, and we're going to continue to work to be a leader when it comes to vaccine distribution.
Now, you mentioned vaccine hesitancy. That's a phrase that we've heard locally, statewide, nationally to describe inequities in the numbers here. How can we make sure that vaccine hesitancy isn't used as a crutch for genuine outreach to communities of color and allow those in charge to just throw up their hands and say, well, it's vaccine hesitancy? How can we prevent that?
Well, we absolutely are not taken that approach here in the state of Michigan. One of the things that we're doing is using something called the CDC's Social Vulnerability Index, which takes into account race, ethnicity, and neighborhood factors like educational attainment, access to transportation, whether doctors exist in communities, all issues that we've worked to address over the long term with our Racial Disparities Task Force and our Poverty Task Force. And we think those will contribute to long-term health outcomes. We're also using that as a factor in how we allocate vaccines as our supply becomes available. We have a supply problem right now. The federal government controls the supply, and right now there are more people who want vaccines than can get them. And as we work with the Biden-Harris administration every single day to get more vaccines into the state of Michigan, we're going to be able to get more available to people to get vaccinated. And I think this will help address those disparities.
Well, one of the groups, in fact, the primary group being targeted right now are older adults, but many older African Americans have deeper memories of overt racial inequalities in the country. Is it realistic to expect that we can have them overcome some of those deep-seated fears in the course of months? We just started rolling out vaccines in December, and we're asking them to, in many ways, put that hesitancy behind them and trust the process.
That's why the state is really putting its money where its mouth is. We're investing in communication strategies and making sure the information and resources are available, not just from the state government, but from trusted neighborhood anchor institutions. The same approach that we took when it came to COVID-19 testing by establishing 23 neighborhood testing sites in the hardest hit zip codes in the state of Michigan, many of which were in the city of Detroit. We're using those same anchor institutions and relationships when it comes to talking about the vaccine and why people need to get vaccinated. And I've been doing this myself. My 83-year-old grandmother, I took her to get vaccinated in Southfield. She got her first dose 2 weeks ago now. And she's someone who had a conversation about why it was important. And I think those kinds of conversations are ultimately what leads to people making the choice to get vaccinated so we all can move forward.
And those conversations will no doubt have to continue. Michigan Lieutenant Governor Garlin Gilchrist, thank you so much for spending time with us and sharing your insight this morning. We really appreciate it.
Thank you, Keenan. Everyone be safe.